In today's healthcare system, nurses are in high demand but short supply, which means the typical nurse is carrying a heavy workload, something that is bound to intensify as a large segment of the population gets older and the demand for care increases. Where a nurse's primary role is to provide direct care and to monitor a patient's health and well-being, new technologies and processes are necessary to maintain and improve the high level of quality care that patients expect. Introducing eMerge, a revolutionary new workflow and medical record system that uses voice commands to document medical procedures and complete physician and RN reports in real time. A system that accurately captures, tracks, and monitors patient data from pre-op to procedure to recovery, and that eliminates the unnecessary manual steps, people, and time involved in the more cumbersome and labor-intensive processes being followed today. And perhaps most importantly, eMerge greatly improves the accuracy and quality of information collected, ensuring a perfectly documented procedure every time. Let's see how it works for endoscopic procedures. Using eMerge's secure web portal, patients can enter pre-op data such as demographics, medications, and allergies prior to arrival at the endoscopy center. This reduces the amount of time nurses have to spend on data entry at patient check-in. All of this information can then be pulled into the patient's chart and made instantly available in the pre-op area, the exam room, and the recovery center. In the exam room, eMerge uses voice commands to document procedure medications, procedure start and end times, milestones, and intraoperative scores with a timestamp. All of this information is automatically imported into the physician's report, thus eliminating the need for a nurse to complete a manual written report after the procedure is finished. The risk of error through verbal and written communications is also mitigated. And just to be sure that everything is correct in the report, eMerge has a playback feature that allows the nurse to review each entry on the spot, and as an extra level of protection, even review each entry visually on a monitor at the nurse's station. eMerge's voice commands are intuitive and include words and phrases that nurses use on a daily basis. Actions performed during procedures are documented in great detail by using simple keywords that also activate workflow processes. eMerge has a custom speech processing engine that only responds to commands intended for specific use cases. Since it only recognizes specific commands, physicians and nurses can have a normal conversation with each other and with the patient, even while listening to music, without interfering with the documentation process. The system is also completely customizable, so workflow, voice commands, and reporting templates can be tailored to unique and specific needs of the users. In a perfect world, operative nurses would not engage in any activity in the exam room other than monitoring the patient. However, today, this isn't always the case. Because of the manual documentation procedures currently being followed, nurses are frequently distracted by having to write down details of a procedure to be included in the report that is written and finalized after the procedure is finished. eMerge is a hands-free system which eliminates this distraction and allows nurses to focus all of their attention on patient care. At the end of a procedure, nurses no longer have to take time to complete documentation. Pathology labels can be printed in the exam room, and requisition can be completed with the click of a button. The entire documentation process goes from about 5 minutes to about 30 seconds. The results are greater patient focus, increased efficiency, and higher staff satisfaction. Once the procedure is completed, eMerge's patient dashboard notifies nurses in the recovery room that a new patient is on the way. eMerge's medication tracking feature lets nurses know what medications were administered. Vital signs are automatically monitored and documented directly in the system, and it's all done without the need to decipher what's written on a paper chart. Instead of recovery nurses having to track patients at regular intervals, the eMerge recovery dashboard monitors all patients and directs recovery nurses to anyone in need of observation. Providing quality care is the goal of any hospital or medical facility, and nurses are an integral part of that process. By eliminating paperwork and streamlining the medical workflow, eMerge allows nurses to devote their full attention to patient care and provides access to many tools that work to improve the quality of that care. eMerge makes an already high-performing endoscopy center that much more efficient and successful. Bottom line, eMerge eliminates paperwork and increases your efficiency while lowering your cost and producing an accurate, perfectly documented report every time. Put eMerge to work for you.